We've arrived at Part 6, page 13, and we're still in Chapter 1, Orientation to the Human Body. So we've been looking at the individual nomenclature issues in terms of referencing parts of the body. So here we were looking at the anterior aspect. So we know that there's a sternal region, there's a pectoral region. The upper arm is sometimes referred to as brachial. The forearm aspect is referred to as antebrachial. Okay, the back here, we have a cervical region and the back because of the neck. Okay, we have the dorsal aspect. These are things intrinsic to the back. Over here, we do have the acromial again. We have the olecranon area, which is the back of the antecubital. We have the antebrachium, the brachium. We have the gluteal region here. We have the, this is a femoral aspect. This is the leg here. Sural is the back of the calf. We have a calcaneal tendon rather than a Achilles tendon, which allows us to bring our toes in a downward position. And here we're demonstrating the plantar surface, which is the sole of the foot. Okay, so know your nomenclature. Everything on that page is certainly fair game. And then we're going to be dealing now with body planes and sections. And here we have a lady who's demonstrating for us the position. First of all, this is anatomical position. Although her hands are a little bit stretched out, it's still anatomical position. The hands are in a downward position. And the palms are forward. The thumbs are lateral, the most lateral aspect of the body. And here we've, how shall I say, we've shown 3 dimensions. Okay, and so whenever we're going to be doing x-raying or any kind of body imaging, we're going to be discussing also and just in terms of referencing things. I'll give you some examples at some point. Okay, but let's begin with bilateral symmetry. Here we have symmetry down the mid-sagittal. This is the sagittal plane. Any plane that intersects the body and creates 2 lateral portions of the body after intersection, that is referred to as a sagittal plane. Okay, so here we have a, where is it being discussed here? Here it is. It's the median, mid-sagittal. Okay, but there's any number of other sagittal planes. Another interesting sagittal plane could be going through mid-clavicular. Usually if you go through the mid-clavicular line, you're also coming through the nipple line. And also it's important on this side of the body to come through the mid-clavicular or nipple line in order to find the mitral valve of the heart. So you can listen. Usually you put your stethoscope right about there and the 5th interspace of the ribs, and you've got the largest valve of the heart to listen to. Okay, so there's a number of ways of using sagittal in a variety of cuts through the body in different divisions. Then we can look at the transverse or horizontal plane. They're calling this transverse, and I'm also indicating it could be considered horizontal. We can bring a horizontal plane here through the umbilicus. What's above the umbilicus then in this plane is the superior aspect. What's below is the inferior aspect. I might ask you, I've placed a transverse plane through the acromial region. That would be the shoulder. In what region would we find the inguinal region? And the inguinal region is down here. And so compared to a transverse plane that's going through the acromial region, the inguinal region is inferior. Okay, that's a simple observation. So it depends on where you put the plane, and we're going to be learning, eventually when you get to neuroscience, you'll get the exciting experience of having CAT scans of the brain, and you'll get to learn the brain and all of its little sequential parts, just the way you like it. Okay, then we have another plane coming from the side. It's called the coronal plane or the frontal plane, and it divides the body into anterior and posterior portions. Okay, so it can be placed in a number of of ways in which we can get that result. Okay, so the 3 planes of the body, just the way you like it there. Okay, then we have basically the text gets into all kinds of scans, and these are 2-dimensional scans. This would be of the brain, and so you don't really know if you're looking from above or below. You're just seeing that 2-dimensional cut, and you have to make an assessment based on that. Okay, so imaging is important in that regard. We have a lot of body cavities in which we're protecting certain parts of the human body. We have a cavity up here called the cranial cavity, in which the brain resides. We have a cavity within the spinal column, the vertebral canal, in which the spinal cord is protected. In both of those cases, we have cerebrospinal fluid, in which the brain and the spinal cord are just floating, actually, away from the bony surfaces, and they're surrounded by connective tissues. We have other cavities which are fairly enclosed for the heart and the lungs because of the importance of their functionality. So we have ribs around the front and the back. We have a sternum in the front. So we have fairly good protection of the heart and the lungs. We have somewhat of a protection for the kidneys because the kidneys are protected by the floating ribs of 11 and 12. Okay, the abdominal region is less protected. So the anterior wall here is soft tissue, but we do have some ribs in the back. Okay, we do have a pelvis, which if you go into the depths of the pelvis, the female gonads and the uterus, as well as the bladder, the urinary bladder, are protected by the pelvic girdle right there. Okay, we have a division of things, but I like to actually look at this sort of little tic-tac-toe illustration right here, in which we've actually created this 9-section box. The 9-section box has its nomenclature, the central portion of which is the umbilicus. If we're up here near the stomach, this is called the epigastric. When we're below the umbilicus, we're in the hypogastric or pubic region. When we're near the ribs, or just inside the ribs, inside the body, we're called hypochondriac, because chondria is a reference to the ribs, the chondral region. So left hypochondriac, right hypochondriac. Over here we have an inguinal or a iliac region. Right here is the top of your hips, where you might balance your baby or your groceries. That would be the iliac crest, so left iliac. Sometimes it's also referred to in its depths as the left inguinal region. Over here we have the right iliac or right inguinal region, just the way you like it. And you can see how do we find where to go for the appendix or any other sort of surgical intervention might be predicated on where we're looking. Or if there's a pain and we have to make a diagnostic assessment, we can determine, is this going to be, if the pain is around here, or does that mean it's a kidney stone? And the answer is no. Kidney stones are in reference to the back of the body, not the front of the body. So anything in the abdominal cavity and through here that can be felt in the front, that's going to be digestive. So those are the thoughts, and that completes our Chapter 1, An Orientation to the Human Body.